If you're over 60, imagine this. You finish a healthy dinner, maybe a salad and some steamed vegetables, feeling confident that you've made smart choices for your body. But by morning, something feels wrong. Your words slur, your arm weakens, or you wake up dizzy without warning. Most people blame sugar, salt, or fried food. But here's the shocking truth. Sometimes, the real culprit is a vegetable you've trusted for years. One that's often labeled heart-healthy or brain-boosting. Yet in aging adults, it can quietly raise stroke risk overnight. I've seen this repeatedly while working with older adults. Foods that once healed your body at 40 can sometimes harm it at 70. As the body ages, the metabolism slows, kidney filtration weakens, and nutrient interactions with medications become more complex. The good news: you don't need to fear food. You just need to understand how your aging body processes it differently. So in today's video, we'll explore 9 common vegetables that may quietly increase stroke risk after 60, and most importantly, how to keep eating them safely. Make sure you watch until the end. The final vegetable is one most seniors eat every week, and it might be the most dangerous of all. Vegetable number 9, corn. For many seniors, corn evokes comfort, warm soup, corn on the cob, or porridge. But beneath its golden sweetness lies a hidden truth. Nutritionally, corn behaves more like a starch than a vegetable. And after 60, that difference can quietly affect your heart and brain. Corn is high in simple carbohydrates that convert rapidly into glucose, causing sharp blood sugar spikes similar to white bread. These surges force the pancreas to release more insulin, followed by a quick sugar crash that triggers stress hormones such as cortisol and adrenaline. Those hormones constrict arteries and thicken the blood, particularly dangerous during sleep when your circulation slows naturally. Over time, this repetitive stress can increase the risk of arterial inflammation, clot formation, and stroke. A 2021 study in the American Journal of Clinical Nutrition linked diets high in high glycemic foods, including corn-based products, to an increased risk of ischemic stroke in adults over 60. Elevated post-meal glucose causes endothelial dysfunction, reducing the flexibility of blood vessels and impairing oxygen delivery to the brain. How to stay safe? Enjoy corn as an occasional side, not a daily staple. Avoid corn-based products like cornflakes and cornmeal, which digest faster. Pair corn with fiber or protein, eggs, beans, or avocado to slow sugar absorption. Avoid eating corn late at night when your metabolism and hydration are at their lowest. Corn remains wholesome and nostalgic, but after 60, it must be treated like a starch, not a vegetable. The key is portion, timing, and pairing. 3 simple rules that turn this comfort food from risky to rewarding. Vegetable number 8, romaine lettuce. For many older adults, a light salad at dinner seems ideal. But romaine lettuce can act as a natural diuretic, encouraging the kidneys to release water and sodium. In younger people, this effect is mild. But after 60, when renal function slows and baroreceptor sensitivity, which detects dehydration, decreases, even mild water loss can thicken the blood. Thicker blood moves more slowly through the arteries, especially those already narrowed by atherosclerosis. This sluggish flow increases the risk of microclots, which can lead to ischemic strokes, particularly during the night when hydration drops. According to research from the American Journal of Hypertension, nighttime dehydration and hemoconcentration, thickened blood, are key contributors to early morning strokes, a pattern often observed in older adults. How to stay safe? Eat romaine earlier in the day, ideally at lunch. Drink a small glass of water if eating salads at dinner. Monitor medications that also act as diuretics. Romaine can still support heart and digestive health. Just adjust your timing and hydration. Vegetable number 7, spinach. Spinach has long been called a superfood, rich in iron, magnesium, and antioxidants like lutein and zeaxanthin, which support eye and brain health. However, the scientific issue lies in oxalates, naturally occurring compounds that bind to calcium. In younger adults, the kidneys easily excrete oxalates. But after 60, glomerular filtration rate, GFR, a key measure of kidney function, begins to decline naturally by about 1 milliliter per minute per year after age 40. When oxalates combine with calcium or vitamin D supplements, they can form calcium oxalate crystals, the same compounds that cause kidney stones. Over time, these crystals may deposit in small blood vessels, contributing to microvascular calcification, a process linked in studies to reduce cerebral blood flow and increase stroke risk. How to stay safe. Eat spinach earlier in the day when kidney filtration is strongest. Avoid pairing it frequently with calcium or vitamin D supplements. Hydrate adequately to support oxalate clearance. Spinach remains powerful, but after 60, it requires smart timing and awareness. Vegetable number 6, broccoli. Broccoli is a cruciferous powerhouse rich in vitamin K, sulforaphane, and fiber, all linked to reduced inflammation and better heart health. But for seniors taking anticoagulants like warfarin, Plavix, or even aspirin, the vitamin K in broccoli can interfere with how your blood clots. Vitamin K helps the liver produce prothrombin, a key clotting factor. Warfarin works by inhibiting this process. When vitamin K intake fluctuates, say you eat large amounts of broccoli one week and none the next, it throws your blood's clotting ability out of balance. This can either thin the blood too much, increasing bleeding risk, or thicken it, raising the chance of a stroke or embolism. Studies published in the Journal of Clinical Pharmacology confirm that maintaining consistent vitamin K intake is essential for stable anticoagulant therapy. How to stay safe. Eat similar amounts of broccoli weekly. Inform your doctor about your typical diet, don't avoid it entirely. Just keep your intake balanced and steady. Consistency keeps your blood and brain safe. Vegetable number 5, raw carrots. Carrots have long been celebrated as one of nature's healthiest snacks. Crunchy, low in calories, and rich in beta-carotene, the antioxidant that converts to vitamin A for sharper vision and stronger immunity. But after age 60, even this vibrant orange vegetable can quietly disrupt your body's delicate balance, especially when eaten raw and late in the evening. Here's the biological reason why. Raw carrots have a high glycemic load, meaning they digest rapidly and release natural sugars into the bloodstream. In younger adults, the pancreas efficiently handles these sugar surges. But in older adults, particularly those with prediabetes, type 2 diabetes, or reduced insulin sensitivity, this rapid sugar spike is followed by an overnight glucose crash. That sudden drop triggers your adrenal glands to release cortisol and adrenaline, hormones that constrict blood vessels and increase blood pressure, precisely when your body should be resting. Combine that with mild dehydration during sleep, and blood viscosity thickens, creating an ideal environment for microclots that can restrict blood flow to the brain. A 2020 study in the Journal of Clinical Endocrinology and Metabolism found that nocturnal hypoglycemia, overnight blood sugar drops, increases sympathetic nervous activity, causing blood vessel constriction and reduced cerebral oxygenation, both early contributors to stroke risk. How to stay safe. Eat carrots earlier in the day and pair them with healthy fats or proteins like hummus, yogurt, or nuts. Avoid eating them solo or late at night. Prefer lightly steamed carrots, which have a lower glycemic effect than raw ones. Carrots remain a nutritional powerhouse, but after 60, timing and pairing are everything. Daytime carrots heal. Nighttime carrots can quietly harm. Vegetable number 4, asparagus. Asparagus often carries the image of a clean, elegant, and health-forward vegetable, a favorite among those who prioritize wellness. But after the age of 60, this sophisticated side dish can quietly challenge your circulation if consumed at the wrong time of day. You see, asparagus is a natural diuretic, rich in compounds like asparagine and potassium, which stimulate the kidneys to excrete excess water and sodium. This process helps regulate blood pressure and reduce bloating, which is beneficial for most adults. However, in seniors, the picture changes. As we age, our kidney filtration rate, GFR, naturally declines, meaning the kidneys process fluids more slowly. Eating asparagus late in the evening can trigger increased urination during the night, leading to overnight dehydration. This dehydration thickens the blood, increasing blood viscosity, which makes it move sluggishly through aging arteries that are already less elastic. When combined with antihypertensive or diuretic medications, the effect can intensify, sometimes causing electrolyte imbalances or mild circulatory sluggishness. According to studies published in the Journal of the American Geriatric Society, dehydration in older adults is linked to reduced cerebral blood flow, which can increase the risk of small clots that block oxygen delivery to the brain, especially during sleep. The fix is simple. Enjoy asparagus at lunch or early dinner, when your body is still active and hydrated. Pair it with water-rich foods like cucumbers, lettuce, or melon, and drink enough fluids throughout the day. If you're taking medications for blood pressure, heart, or kidney health, it's wise to ask your doctor whether asparagus could amplify those effects. Asparagus remains one of nature's most nutrient-dense vegetables, packed with vitamin K, folate, and glutathione, which protect the heart, brain, and skin. But like many health foods, its benefits depend on timing and balance, especially after 60. Eat it early, stay hydrated, and you can preserve its goodness without hidden overnight risks. Vegetable number 3, garlic. Garlic has earned its place in every heart-healthy diet for good reason. It lowers blood pressure, strengthens immunity, and contains powerful compounds like allicin and sulfur-based antioxidants that support healthy circulation. However, for older adults, especially those taking blood-thinning medications, garlic's very strength can become a hidden danger. Here's what happens. Garlic naturally inhibits platelet aggregation, the process your blood uses to clot. When combined with prescription anticoagulants such as warfarin, clopidogrel, or even daily aspirin, the effect can amplify beyond control, leaving blood too thin. This increases the risk of internal bleeding, dizziness, or even hemorrhagic stroke, where fragile brain vessels rupture under pressure. Research from the Journal of Agricultural and Food Chemistry, 2019, shows that allicin significantly inhibits thromboxane synthesis, a key clot-forming compound, by up to 45%. While this property protects the heart in moderation, excessive or supplemental garlic can overstimulate the effect, particularly in those already on medication. How to stay safe? Use garlic in small amounts and cook it lightly to reduce allicin potency. Avoid garlic supplements unless approved by your doctor. Watch for early warning signs like frequent nosebleeds, bruising, or prolonged fatigue. Garlic remains nature's medicine, but after 60, it must be treated like medicine. Used correctly, it protects the heart. Used carelessly, it may endanger the brain. Vegetable number 2, onions. Onions are packed with flavonoids and sulfur compounds that reduce inflammation, lower cholesterol, and enhance circulation. They've rightfully earned a reputation as a cardiovascular superfood. Yet for seniors over 60, especially those taking antihypertensive or anticoagulant medications, onions can quietly tip the body's vascular balance. The key lies in quercetin, a potent antioxidant found in onions. Quercetin dilates blood vessels and reduces clotting, beneficial in moderation, but risky when paired with blood pressure or blood-thinning drugs. This combination can cause hypotension, blood pressure that's too low, leading to dizziness, weakness, or even temporary brain oxygen deprivation. Overnight, when blood flow naturally slows and hydration drops, the risk of a mini-stroke, TIA, quietly increases. A 2018 study in phytotherapy research found that quercetin supplementation lowered systolic blood pressure by an average of 5 to 7 millimeters of mercury, enough to induce lightheadedness in older adults already on antihypertensive medication. Additionally, quercetin's effect on platelet activity can increase bleeding risk when combined with drugs like warfarin or clopidogrel. How to stay safe? Use onions as a flavor enhancer, not the main dish. Cook them lightly since heat reduces quercetin concentration. Avoid heavy onion-based meals late at night. Stay hydrated and inform your doctor about your onion intake if you're on circulation medications. Onions still deserve a place on your plate, but after 60, balance and timing are vital. A little brings protection. Too much at the wrong time can strain your brain and blood flow. Vegetable number 1, tomatoes. Tomatoes have long symbolized health and vitality, colorful, refreshing, and loaded with antioxidants like lycopene, which supports heart and prostate health. Yet, after 60, this kitchen staple can sometimes cause unexpected issues related to circulation and nerve function. Tomatoes belong to the nightshade family, Solanaceae, which also includes potatoes, eggplants, and peppers. These plants contain natural compounds such as solanine, tyramine, and histamine. While harmless in moderation, these substances can have a stronger impact on aging blood vessels and nervous systems. Solanine, for instance, can mildly affect acetylcholine, a neurotransmitter that helps regulate muscle contraction and vascular tone. In sensitive individuals, this can cause unpredictable blood vessel constriction or dilation, leading to sensations like dizziness, tingling, or headaches, symptoms that sometimes resemble early warning signs of circulatory problems or even mild stroke-like episodes. Additionally, the natural acidity of tomatoes can interfere with the body's electrolyte balance, particularly calcium and magnesium, minerals essential for steady nerve signaling and muscle relaxation. Low nighttime magnesium levels are linked to irregular heartbeat, muscle cramps, and blood pressure instability. Scientific studies, including those published in Nutrients and the American Journal of Clinical Nutrition, highlight that excessive nighttime acid intake can affect sleep quality and autonomic stability, especially in seniors with hypertension or acid reflux. To stay safe, avoid heavy tomato-based meals right before bedtime. Instead, enjoy tomatoes at breakfast or lunch, when your body can metabolize their acids efficiently. Cooking tomatoes gently helps reduce solanine levels and makes lycopene more bioavailable, up to 4 times higher than in raw tomatoes. Pair them with magnesium-rich foods like spinach, avocado, or pumpkin seeds to balance acidity and protect nerve and muscle function. Tomatoes are still a cornerstone of heart-protective nutrition. But after 60, the key is moderation, timing, and self-awareness. Enjoy them wisely, and they'll continue to protect your health instead of becoming a hidden trigger. After hearing about these vegetables and their hidden risks, it's natural to feel surprised. We've always been told that vegetables are always good for us. And for the most part, that's true. But after 60, the body's physiology changes dramatically. The kidneys filter more slowly, the arteries lose elasticity, and the body's hydration balance becomes more delicate. Even the healthiest foods can behave differently in an aging body. What once was cleansing in your 30s can become dehydrating in your 70s. The secret isn't to avoid vegetables, it's to eat them with awareness. The science of longevity teaches us that health after 60 isn't just about what you eat, but when and how you eat it. By hydrating properly, spacing your meals, and considering medication interactions, you can enjoy your favorite vegetables without worry. Because knowledge isn't restriction, it's empowerment. This video is for educational purposes only and is not a substitute for professional medical advice. Every senior's health condition is unique, especially if you're taking prescription medications or managing chronic illnesses. Always consult your healthcare provider before making dietary changes. Today, we revealed how everyday vegetables like asparagus and tomatoes can affect circulation and hydration after 60. Not to scare you, but to empower you with knowledge. They are your body's signal that something deeper is draining your strength. Possibly anemia, inflammation, or nutrient loss linked to colon dysfunction. Ignoring them can allow disease to progress silently. Early testing, such as CBC complete blood count, for anemia and colonoscopy for structural abnormalities, can help detect colon cancer before it spreads, when treatment success rates exceed 90% for localized cases. By recognizing the key signs, persistent bowel changes, blood in stool, abdominal pain, unexplained weight loss, and constant fatigue, you give yourself the best chance for early detection and survival. Colon cancer caught early is highly treatable, but ignored symptoms can allow it to advance silently. If any of these signs sound familiar, don't delay. Schedule a medical checkup today. And if you found this video helpful, please like, share, and subscribe to help us spread awareness. Together, we can empower more people to detect colon cancer early, protect their health, and live stronger, longer lives. Thank you for watching, and I'll see you in the next video.